be better if you can start again. Yeah.
Yeah, I request all the speakers to mute yourself for 1 minute. Saurabh, can you confirm?
Yes, sir, it is live.
Okay.
Can you confirm the number of participants in YouTube also? How much of students have joined? That is more important.
They are 10. They are 10.
10 in the.
Yeah. So, I request again to all our guests to please mute yourself. So I'm going to start because we are live now. Good afternoon, one and all. I, Mr. Rajiv, working as a project coordinator in Advancing Tobacco Control Project at Department of Community Medicine, School of Public Health, PGI Chandigarh, would like to welcome you all on behalf of E-Resource Center for Tobacco Control under Department of Community Medicine, School of Public Health, PGI Chandigarh and AIIMS Bhubaneswar in collaboration with Department of Health and Family Welfare and Higher Education Department of Odisha with the support of International Union Against Tuberculosis and Lung Disease, the Union. With this backdrop, I now invite Dr. Vinod Patro, Additional Professor of Department of Community Medicine and Family Medicine, AIIMS Bhubaneswar. He is additional medical superintendent and associate dean research at AIIMS Bhubaneswar. He has more than 50 publications in reputed international and national journal to his credit, including award and certification. Dr. Patro is a nodal officer for COVID-19 for AIIMS Bhubaneswar and member of state monitoring team, various public health team, including COVID-19. He has contributed more than 20 years as a clinician in medical teaching and research. He is also a visiting faculty to various government academic medical institutions and member of various important monitoring team. So I welcome you, sir. Can you please address the audience? And welcome all. Yeah,
yeah,
thank you.
Rajiv. Thank you very much. Good afternoon. Namaskar. DPH sir just asked while you were talking how many people are on YouTube live. So can you just update the stats? Sir, as this program is on Zoom, the parallel it is on live on YouTube. All the participants except the resource persons are allowed to log into the YouTube link. Otherwise, Zoom will be a little disturbed. So that Rajiv will update in a while. So in the meantime, I would start by welcoming.
Yes, sir.
This is a good partnership, example of partnership for tobacco control. What is more important is not science. The importance is more, it has to be a good partnership. So as we see, this is a extremely good initiative by academic institutions, Department of Health and Family Welfare, and Department of Higher Education, School and Mass Education Department and Higher Education. So this is the way forward, and we have NSS on board. Surekha Madam is on board. So this is the way forward. We look forward to different platforms for tobacco control. When you look at tobacco control, we work in different platforms. One important platform is educational institutions. So educational institutions is addresses to 3-4 things, because when we look at tobacco epidemiology, Dr. Sonu Goyal will talk on that. When we look at tobacco epidemiology, one thing we look at is age of initiation, tobacco among adolescents, tobacco use among adolescents. In Odisha में भी जो tobacco का prevalence and tobacco का rates, Dr. Rasmi will talk little. The state nodal officer will be able to lay hands on the primary data. But what we have, national level data talks that around 40% people consume, and we have a dubious distinction of using smokeless tobacco. So the whole idea is it requires partnership. It requires a multi-pronged approach. One platform is tobacco-free institutions, where the government has some plans. Government of Odisha is one of the leading sector which works very extensively on educational institutions, because this can be piggybacked to RBSK school health program and other things which are there. Government has continuously in alliance with schools for different health programs. So this can be easily piggybacked, and the interventions will not cost much. So with this, I will stop here, Rajiv. I welcome Niranjan sir, Director Public Health, Rasmi Ranjan Satpathy, the State Nodal Officer, Additional Director, Surekha Madam, the Deputy Secretary and State Chief of NSS, Dr. Sonu Goel, my colleague, Professor and Chief of RTCT at PGIMER Chandigarh, Rajiv, the program coordinator of this, Biswaranjan Purohit, Girija, Dr. Girija, the state consultant for tobacco control, we have been working for now more than 5 districts. Now we are expanding to 10 districts. So with this, I welcome one and all, and this next 1.5 hours will be very useful for all the participants. Thank you.
Thank you, sir. Thank you for your kind word. And now I request our Professor Sonu Goel, Director and Professor PGIMER Chandigarh. Sir has a 17-year rich experience in public health and health management. He has an alumni of Johns Hopkins School and Public Health, Baltimore, US, and Maastricht University, the Netherlands. Sir has awarded a Public Health Excellence of India by Honorable Union Health Minister Welfare in 2014. Sir is a Program Director for International Public Health Management Development by Ministry of External Affairs. I welcome you, sir.
So thanks, Rajiv. So first of all, I'd like to thank the organizers, Dr. Patro and the team, for conducting this very useful webinar. We have been looking for quite some time now regarding happening of this particular webinar, which is really important. And considering the fact that the youth, we need to prevent smoking initiation among youth, because that is easy as compared to when we want a person who is in fag end of the life or in the middle age to quit smoking. So initiation is quitting, or initiation is better, how to prevent initiation rather than quitting. So that's why the important and role of this particular webinar is where the students and the teacher will be motivated to educate the students about the harmful effects of tobacco. Although everybody know about the harms of tobacco, but when it comes again and again in front of the eyes, then they realize. And these students are the peer educators, basically. When they go to the home, they tell their parents, they tell their father, mother, friends that we should not smoke, we should not do all those things, and people listen to them. So thanks, Dr. Patro, for initiating this talk, and I'm really thankful to all the dignitaries on the dais who have agreed to come, whether it is from the health department, from the education department, and from all the departments which are really stakeholders of Odisha. So I'm really thankful that all of you made it happen on this day. And I have very fond memories of Odisha. Actually, we are, besides Dr. Patro and many other colleagues there who are my friends and who has gone from PGI, we are conducting executive leadership program with Government of Odisha. So that is another thing which we are conducting, and it's a bilateral program where along with university in Thailand, Mahidol University, we are conducting this program for managers. And we are conducting many other things, trainings and joint activities. And beside this, this is the project which we are talking about. This project was initially for 2 years, now extended for another 2 years. This is a Bloomberg Initiative project, Bloomberg Initiative to Reduce Tobacco Control. So we started this project in 2017, and now we are in 2021, and we are expecting this project to run for quite some time more. And we started building capacity of our stakeholders of 4 states in country. We selected 4 states. I'll be talking in a bit later. And we did the mapping of the states, what things are needed. We did stakeholder analysis, and we found that there are few things which are very exciting, which from all the states, and there are few things where there are challenges, and we found opportunities in among these challenges, and we try to fulfill those opportunities so that we advance tobacco control in the areas. So that's what our journey started in 2017-18. After mapping, we started advancing so that we have Article 5.3 policy in 3 states. Basically, Meghalaya we have already done. This is about tobacco industry interference. Like tobacco industry should not partner with the government. So Meghalaya has already done it, and 3 states, including Odisha, I think it is in pipeline, and we will be hearing soon from them that we have the code of conduct. Ministry of Health has already issued the code of conduct at the national level. So this is what I think I want to hear from our dignitaries, that we are progressing towards Article 5.3 policy. We started having SLCC meetings and DLCC meetings there. In Odisha also, it happened last year, and we are hoping another SLCC meeting and DLCC meetings. And we also established a National Resource Center for Tobacco Control. So that was the resource center we established in 2018 with Health Secretary Mrs. Preeti Sudan. So all the partners in tobacco control, 25 organizations met together, and that's what we initiated the resource center. And now we have over 2.5 lakh viewers in this resource center, which contain all IEC materials, orders, circulars, everything under one roof. So anybody want to take some circulars from different states, so I think this is a portal where we can look for. Now we are in 2021, and we have few more activities in conducting workshop, conducting webinars. So this is a part of that which we are doing. Next, Rajiv, can you move to next slide? So I think we have expanded our I think back. So these are the 4 states which I was talking about. So the four states, can you, yeah, these are the 4 states. Odisha. So previously in first phase of the project, we have 5 districts. So now we are intensively working on 10 districts, but it doesn't mean that we will only work on these 10 districts. We will work on entire Odisha, because ultimate aim is strengthening tobacco control. So then we are working in Telangana, few districts, again 10 districts in Telangana. We had 2 districts in Puducherry in last, and now we have entire Puducherry where we are working. And previously we have 4 districts of Meghalaya. Now we have entire Meghalaya with us. So I think this is the, we were working in 14 districts initially, and now we are working in almost 28 districts intensively in 4 states. So there were some objectives that we want to strengthen the tobacco control administrative framework and provide technical support to the partners, and providing monitoring and evaluation to the National Tobacco Control Program, and establish the Resource Center for Tobacco Control. Next. So, and these are our partners. We have like All India Institute Bhubaneswar, GIPMER Puducherry, NIGRIMS Shillong, and Gandhi Medical College in Hyderabad. So they are working directly with us, although the state nodal officers are also our partners, but they're working, we all are working in a very tandem fashion. So I think this was my last slide. This just a brief thing about the e-resource center for tobacco control. So these are all the things which are present. So they are in thousands now: policies, legislation, circular, advisories, notification, IEC material from different state, National Tobacco Control Program publications, orders. So we have all the resources present now, authentic resources present under one roof. So anybody can go for this. And this is our bi-monthly newsletter, and it is theme-based newsletter. Till now, we have 9 editions of this newsletter, and today we are releasing the 10th edition of this newsletter. So we have various topics in this newsletter earlier, like we have e-cigarettes, we have smoke-free tobacco, and we have many other. So this time we have tobacco-free educational institutes this time. So thank you very much. Thank you for their patience. And I look forward to a exciting webinar.
Thank you, sir. Now I move to our next guest, Dr. Niranjan Mishra. He is the Director and Public Health, Government of Odisha. Sir has a degree of MBBS, a Master in Surgery, and he has more than 35-year experience as a surgeon and medical administrator. Sir has also served as a Chief District Medical and Public Health Office of Dankal districts and Head of Department of Surgery, Capital Hospital, Bhubaneswar, Odisha. I welcome you, sir, Dr. Niranjan Mishra.
Thank you, sir, and good afternoon, everybody. Welcome to this good afternoon session. Dr. Patra, Dr. Rajiv Kumar, Dr. Sonu Goyal, my colleagues, Dr. Satpathy, Dr. Swai. Am I audible?
Yes, sir. Yes, sir.
And Dr. Girija. And from Education Department, Madam Swai, who is the State NSS Coordinator. Through her, we are connected to nearly what I learned more than 2,050 students on YouTube. What the message is for them actually. The whole effort is to make our educational institutions tobacco free. As you know, tobacco is a great problem and is a killer with so much of complications, involvement of almost all systems of the body. Can I have my slides here?
Dr. Purohit, please put up the slides, please.
So, so this is a big issue. As far as we are concerned, we have a National Tobacco Control Program, but it is really difficult on our part alone to carry forward these messages and to involve all the educational institutions. We have started an initiative of declaring some of the institutions, educational institutions, tobacco free in almost in all. We have assigned to make at least two or three educational institutions in all health and wellness centers tobacco free, but at this pace we are not going to have our goal achieved. For that reason, we have to carry forward this message to our friends in the education department, particularly higher education department, as it is already told that in India, the average age of starting smoking is around 17 years. And I believe it is much lesser in smokeless tobaccos. A lot of young boys have started taking these gutkhas, khainis, because they are cheap and easily available. In spite of a ban, they are available in the market. So a lot of the students get involved into all these habits, making not only because, you know, this is a period when they cross over from a period of juvenile delinquency to adulthood, where there is the unstable emotional status, they are unstable, they are very in a labile stage of decision making. They are fresh from home, exposed to the society, exposed, almost enjoying their freedom. They are likely that at the colleges or the higher education spheres, under pressure from different angles, from their social burden, from their social interactions, from their educational burdens, they will be exposed to these habits through peer pressure or through so much of fantasies they carry that they think that this is a style statement, this is a status symbol, this can reduce their stress, they can elevate their mood. They've learned it from different sources, from films, from advertisements, surrogate advertisements. They get it explored from their friends, from their elders. So this is actually this is a period when they are induced to all these habits and can influence their whole life, their profession, their education. There can be interferences in their studies. There can be interferences in their social behavior because of these tobacco habits. We are our concern is to involve our friends in the Department of Education to see that all these educational institutions become tobacco free. That is that will be that will be a big achievement if you can do it, because it's the period of induction to tobacco addictions. So we have a fresh a set of guidelines issued, but whole purpose is to yes, that is it. That is it. Go to next. Go to next. Yes. So this is the tobacco burden in India. Nearly 267 million tobacco users in India. Among adults, 28% currently tobacco. From all adults, men around 42%. How many what? 14%. Then adult use smokeless tobacco, men around 29%, women 12.8%, 10.7% of all the adult they are smoke tobacco. So this is almost the burden cigarette comes around 4% of the consumption. Is 7.7%, and smokeless tobacco is a huge what I told earlier is around 21%, particularly in Odisha. This is a big burden of smokeless tobaccos. Next, please. Next. So 10 million, around 10 million tobacco users in Odisha. 45% among the adults of Odisha use tobacco. You see this huge burden. Smokers comes around 7%, and smokeless tobacco around 42% of this group. Next. Next, please. Yes, the tobacco versus youth. Global youth tobacco survey and global adult tobacco survey indicate that there is a significant tobacco use among adolescent and young adults because of the causes I have enumerated earlier. The mean age of tobacco use in India is 17. I have told it earlier. Therefore, the government of India has released a set of guidelines for tobacco-free schools, educational institutions in 2008, and step-by-step guidelines for implementation of Section 6 of the COTPA Act. Though there was a guideline for implementation of rules in a big challenge because there's a huge number of schools, colleges, and involvement of different agencies. Next, please. Next slide. So this is why people start smoking. There is peer pressure. They think that it is cool to have some of these addictions. Their parents smoke. They learn smoking from their parents because they want to look very fashionable and skinny. Some people start smoking this, and because they find it relaxing also. There is a false conception that it relaxes your mood, and some of are because of their rebellion to the society, to the school, to the educational pressure, and to the social pressure too. Next. These are common facts. I have put it for the message to go to the audience we have in the YouTube, particularly the students. So implementation of these guidelines require about the harmful effect of these tobaccos, particularly through these visual media. You have to see the number of cases we are having this advanced stage of cancer. That the tobacco can involve almost all systems of the body and can make and can kill you also. A lot of people do not know, particularly the small children, they do not know that this is so harmful. This can addict farming, and this can bring danger to them. They think that they can quit at any time. They have a self-confidence that they can quit any time. To start out of curiosity, but we became habituated to this. Then we have to create awareness about various venues available for tobacco cessation. We have to make them available to them, that those who are in tobacco can leave it, and how to leave it also we have to guide them. Then healthy and tobacco-free environment, educational institution and educational institution have to be made tobacco-free, and we have to have this awareness for better implementation of legal provisions under the COTPA Act. particularly involving the younger age group and particularly involving the students. Next. So this is a little bit about the tobacco contributing the major of the NCD issues and so major of the is a contributor to almost all diseases involving this non-communicable diseases. Next. So this is again for the message of all these audience in the YouTube, the young students of the colleges, to see that this can cause cancer of oral cavity, cancer of lungs, you can have heart diseases, you can have this COPD, then there are erectile dysfunctions and gangrene of the food because of bursars, and it can cause stroke, and almost all diseases like hypertension, heart diseases, all the diseases can be, tobacco can be contributor to all these. And major is one of the very important cancers detected in our part of the world is the oral cavity cancers, and a major contributor is this chewing form of tobacco. Next. So to make tobacco-free educational institutions essential, there is a provision under Section 6B of the Tobacco Control Act 2003. It prevents, prohibits sale of tobacco within a radius of 100 yards of the educational institutions, and also there is a restriction to sell these products to the children. Next. Under this act, so these are the provision of this law under COTPA Act. Under Section 6A is to ban and sale of tobacco products to children below 18 years. Then no tobacco use and sale inside and within 100 yards of educational institutions. Then ban on smoking in public places is under Section 4, and Section 5 prohibits advertisement of tobaccos and tobacco products in any form. This should be scrupulously, strictly implemented. Particularly, all educational institutions should educate students through IC material, through display boards, that this is there is restriction by law that this should not be sold within 100 yards of radius of the educational institution, and if necessary, the teachers or the principal can take help of the law enforcing agency to close it down and take appropriate action against those violators of this provision. Next. So there are some for these implementation in college-based intervention. We can do some innovative activities. The peer counselors to be identified, those who can influence their friends, their other students that this is bad and how to leave it, and they in turn should identify enroll tobacco users. Then capacity building and counseling to develop self-esteem, social skill, goal setting, decision making, communication skill, the drug refusal skill. These are to be promoted, and you can develop some peer counselors in the team who can talk to these boys. They can persuade them. Also, it is a good practice. I have seen in some schools they persuade them to declare that I am a tobacco user in common forum, and to announce that I promise to leave it within next 3 months and 4 months. And also, it is also good practice to celebrate those who do it, leave it, these habits. They can, in a gathering, they can declare that I was a smoker, I have left it, and the others should cheer it. They should be role models to others, and these people should be used as these peer leaders to educate others and to carry forward these messages. So these type of activities and innovations has to be made at the level of educational institution, so that there is more of participation of students, and there is voluntary disclosure, and there is a mass movement among the students that they have to leave this habit, and they can declare openly that I was a smoker, I was a tobacco user, and I have decided to leave it. Next. So for this to help those who are interested in tobacco cessation, there is a national toll-free numbers. Next slide, please. Toll-free number, one can take help of if he do not want to come forward to open his intentions. He can call these numbers. And first one is a toll-free number to this is a helpline for tobacco cessation. One can call it. They can talk to you in your mother tongue and give advice how to go for the cessation. And the next one is I think message-based service. One can avail this. And the third one is to report these violation of code around the school. And so these are some of the suggestive activities in educational institutions. And I appeal our friends in the education department to make it as a mass movement. To from their side also, we are putting our effort, and from their side to declare their institutions tobacco free. As you all know that the passive smokers are more dangerous than active smokers. When a student smokes, all his friends become passive smokers and become involved. This is to be again described and told to all students that if one become a smoker or a tobacco chewer, he influences other to induce in this habit. So this should be made a mass movement in all our educational institutions, and almost all institutions, particularly Odisha. I will appeal the higher education department to make a concerted effort to declare all our institutions tobacco free and make it this awareness campaign among students very, very effective, particularly through the media of these NSS, because we have a strong NSS network. The NSS should work as a peer group and a pressure group for this, to carry forward these messages and make it happen in all our educational institutions, so that the students do not become victim to these bad habits, do not carry forward these to get these diseases, non-communicable diseases and cancers and all these, and to make a smokeless and tobacco-free nation as a whole. All the colleges and schools should contribute. Next. That much I think I have to say. If my message, our appeal and message is carried forward to students who are listening, and who our friends in the Department of Education, those who are associated with this web discussion, they must make it a movement, particularly through NSS, that this is a big activity. If you can make all our educational institutions tobacco free and sensitize all our students who are in the fold of tobacco or non-chewable tobaccos to leave it, to make it a campaign as a whole, and participate in the national campaign of tobacco control program. This will be a big achievement, and I believe Odisha will lead the way to have some achievement. And thank AIIMS Bhubaneswar and my friends from AIIMS, Dr. Patra and all those resource persons who are participating this, to enlighten us and enlighten all our listeners. Thank you again. Before closing my opinion, I think that's all. Thank you all. Thank you again, giving me the opportunity to speak to all of you. Thanks.
Thank you, sir. We have just disconnected with our chief guest. So in the meantime, just a minute. Ma'am is just joining us. Yes, ma'am, you are here. Yeah, so we are honored to have with us Dr. Sureka Sundri Swain, Deputy Secretary cum NSS Coordinator, Higher Education Department, Government of Odisha. She is an Associate Professor in Education and presently working as a State NSS Officer Deputy Secretary in Department of Higher Education, Government of Odisha. And ma'am has 33 years of teaching and research experience. She has done her Master in Education, First Class Gold Medalist, MPhil from Punjab University, Chandigarh, and PhD from Utkal University, Bhubaneswar. She has done 100 publications to her credit in a book and national and international journal. Ma'am has authored and edited of books. Ma'am has produced 3 PhDs, 12 MPhils, and 40 MA and MA dissertations. She has awarded by the Governor and Chief Minister of Odisha for contributing to the field of plantation and environment, and awarded by many government and other agencies. I welcome you, ma'am.
I think we do not have her right now. Yes.
Yes, sir.
Yeah, yeah, it was disconnected. So, very good
Yes,
evening to one and all. Jai Jagannath. Dr. Niranjan Mishra, sir, esteemed Director, Public Health, Government of Odisha. Dr. Sushant Kumar Swain, sir, Additional Director and SNO, Government of Odisha. Dr. Rasbiranjan Satti, sir, Additional Director. Dr. Rana Singh, Regional Director, Delhi. Dr. Son Goel ji, Professor PGIMER, Chandigarh. Dr. Rajiv Chauhan, Project Coordinator. Dr. Vinod Kumar Patra, Additional Professor, AIIMS Bhubaneswar. All the invitees, resource persons, NSS program officers, volunteers, YRs, all the teachers, students, and all those who are associated with this program. It is really on my part to be on really campus and for all the students, those teenagers in the schools and colleges. Important programs also.
I think ma'am has poor connections. So we can wait for a minute if ma'am connected again.
I think as soon as she arrives, so we can have her. So Rajiv.
Yes, sir. Yes, sir. So can I go forward?
Yeah.
Yeah. Thank you. So with this, I now invite our next speaker. Sorry, before going to the technical discussions, so we have a official release of our tobacco free time bi-monthly newsletter. Just hold on. I request Dr. Sonu Goel to proceed our official release of 10th edition of Tobacco Free Time. Dr. Sonu Goel.
I think, as I have already told, that we have been doing this task of having release of tobacco-free time at some good juncture. So what a good juncture it can be, then when all the school teachers and students are there, and the theme of today's tobacco-free time is tobacco-free educational institutes. So I would request all the dignitaries, Dr. Niranjan Mishra, Dr. Satpathy, Madam Surekha, if she's here, Dr. Girija, Dr. Patro, to say release for this, and then I think I will tell you about what this contained. So we all say release in one go, unmute ourselves, and then so release.
Please.
Yes, so I think we can cut this ribbon now. Yes, so as I told that this tobacco-free time, so we had released the 9th edition of tobacco-free time during an international tobacco-free summit, which was held lately, and it was attended by 650 plus participants from India as well as 14 countries. So then it was released, the 9th edition, and 10th edition we are releasing today during this. So the main aim of this theme was tobacco-free educational institution. So we have been asked by many that what is a tobacco-free educational institution? What can we do as a NGO, as a government partner, or as a implementer? What will be our role and responsibilities? So we have compiled all the roles and responsibility of each partner, of each stakeholder in this 12-page edition, which not only contains this special edition of tobacco-free times, this thing, but also contain a lot of news occurring globally, as well as in India, related to tobacco control. So this all contains, this is a very brief summary. You can see few circulars, and recently government of Himachal released a very comprehensive circular on tobacco-free education institutions. So it contains all the guidelines and everything which is there. So we have tried to summarize every circulars and guidelines in this particular tobacco-free time edition. So after this, we'll be mailing this tobacco-free time to all of you. So thank you very much.
Thank you, sir, for releasing this 10th edition of tobacco-free time. Now I invite our next speaker, Dr. Rashmi Ranjan Satpathy. He is an Additional Director and State Nodal Officer for National Tobacco Control Program under Health and Family Welfare Department, Government of Odisha. Sir has done a degree MBBS and Master in Community Medicine. Sir has more than 25-year experience in clinical and program management. Sir has served as a charge of emergency medical services in Capital Hospital, Bhubaneswar. Yes, ma'am. Yes, ma'am.
Hello.
Yes, ma'am.
Yeah, yes, sir. It was disconnected, sir, due to some network problem, I think.
Yes, ma'am. Please.
So I'll be taking just 1 minute, sir. I'll complete because I have another meeting with the Commissioner Secretary, sir. So thank you, sir, for organizing such a beautiful meeting, and all our college students, teachers, they have joined this meeting. And this program is already taken up by us at the college level by our Commissioner Secretary. We had a video conferencing meeting with all teachers and the principals of the colleges, and some training programs will be taken up in each every college. Programs in our states.
I think there is some network issue, ma'am. I think.
Ma'am, can you unmute yourself, please? Yes. Yes, I think there is some internet issue with the.
So I think in the meantime, Dr. Surekha is here with us and she might be going for her next meeting. So just she can hear, I think, although there's a network connectivity, but she can hear ourselves. So we want to make one or two requests to her because as Madam has said that she's working intensively, her department is working intensively for making all tobacco-free education institution. So I request that a circular from your end, ma'am, can go to all the schools and educational institutions. We can send you all the guidelines. Now the guidelines are available. We can send you the circular and guidelines which are there for it. And the schools and educational institution can self-certify. Initially, they can self-certify that we are following these guidelines, and they can submit that self-declaration to you. I think that will make a big difference initially. And then I think we can make a random selection of few institutions where the team can go and see whether they are really doing well. So ma'am, this is the request which we can do initially, and later on we can build a collaboration with the, I think, education department, because that plays a very important role. Yeah, so so I'm over basically, yeah. So you can continue, Rajiv.
Thank you, sir. So now I request our next speaker, Dr. Rashmi Ranjan Satpathy, to proceed their lecture on the next topic.
Good evening, all. And this is Dr. Satpathy, and most of us are in touch for one or other program many a times in the recent past, and as well as in the period also. We are fortunate to have Swami Madam here from the Education Department, because we believe this FEI, this Tobacco Free Educational Institution Initiative, is definitely a great one, but let us not keep it on the paper. We must bring it to the field and to the execution. And for that, actually, the implementing agency, the educational institution, they definitely play a very pivotal role. And to go ahead, the next slide, please. Just to have the load of this, or the we can say prevalence of this tobacco use among the Indian youth, that is the 13 to 15. When we talk of this tobacco-free educational institutions, though there is a shift of this initiation of tobacco smoking by age, the last study is definitely quite a few years back. We do not have a very recent updated one, but then though there is a shift, that means much younger and younger students are attracted to this tobacco use. And with that perspective, it is very imperative, very important to have tobacco-free educational institutions. I mean, the educational institutions of schools, higher schools, and colleges, they must come up with some plan some plan of action to have their institutions tobacco-free. So this is just to have this. The slide is the next one, please. Next slide, please. Yeah, this is among the teachers and administration. If I talk of stop tobacco, if I am to lead a stop tobacco or stop chewing campaign from the state perspective, I had to have quit my tobacco taking habits, if at all I have. So that's how the teachers and administration, they must play a pivotal role to combat this tobacco use among schools, because if these are the persons who would be taking and then saying to the students, let us not use this tobacco, then it will all be meaningless. The current tobacco uses for these teachers and administration, we can see, is something quite a sizable one. This is almost 1 in 5, we can say, though it is in one or other form, which is quite a high. So if that means if one of the 5 teacher be taking this, then the students may not be adhered to the norms and guidelines that we are trying to impose upon. So they are also a point of focus, a point to be focused on for this tobacco control measures. And through this department, I would really request Shwai Madam, if at all she is there, to take it up, that all the stakeholders, all those inside the premises, be it the students, be it the teachers, be it all the staff, they should not use this tobacco in the educational institutions. Next slide, please. So this, all of us know how many percentage of this younger students, I mean younger ones, are taking tobacco, be it for the sake of fashion, or be it for the sake of you can say compulsion, or due to depression, due to some other causes, whatever be the cause. But then this is quite a sizable one, considering the fact, the age of initiation of this. And younger the person is, younger the person when he takes tobacco, more is he prone to get the seriousness of the illnesses out of this tobacco use in his lifetime or her lifetime. The next one, please. So this intervention to protect the students from tobacco means its proper implementation of the tobacco control. I mean, having done this COTPA Act and then saying again and again that there is an act to combat this is not going to help it, because we have seen it for quite some time that having it on the file and having it on the rule book doesn't make doesn't necessarily make the changes on the ground level. We had to do this. We have to bring this to the implementation level. Then educational institutions are the prime targets, as you say, because of the shifting of this tobacco users. So that is one thing that we must look at. And then, as we know that this initiative by the teachers, staffs, then we can also promote some writing and anti-tobacco slogans in educational institutions. And they all have to have some handy, once we do these observations on World No Tobacco Day, we used to celebrate, we used to observe those days through the seminars, through the campaign, through the workshops. But my question here is, are they sufficient? Are not they very short-lived, like the day is gone, the next day is another day, and that day they can again be the same. Next, please. So coming to the tobacco-free educational institution, if you can see the journey so far is in 2009, CBSE made a circular to declare all the CBSE schools tobacco-free. So if you can see it intrinsically, if CBSE can do this, why can't we and why can't the other state government impose this through their department in the schools they own? This has to be, there has to have some welfare, there has to have some initiative, there has to have some plan and action that needs to be taken, and which is really very, very, very important at this point of time, this very chance. Next, please. These are few guidelines that has already been issued through the government of Odisha Higher Education Department. This date backs to almost a year back, I would say. And this is for the implementation of the revised COTPA, the guidelines and all that that had been shared, but bringing it to the reality and bringing it to the action definitely needs more stringent monitoring and follow from all the sections, not only from the Department of Education, not only from the Department of Health. It may be a joint and coordinated one along with the law enforcers. These have to be done. The next, please. This is also another letter of, that was communicated during that period of time, that the new guidelines were said and all. What I mean to say that in the state like Odisha, where the prevalence of tobacco, I mean the use of smokeless tobacco is much more than the smoking tobacco, and be it at the which really poses a great threat. But if these orders can be served, why can't these be implemented at the ground level? If these are to be implemented, then more and more coordinated action is required. So it is not that if we have not communicated these rules and rule books and communications down to the level, we have done it, but sitting only by communicating this is not going to help it out. We have to go and fight it out and have to do on the ground itself. The next please. Next please. So as an initiative from the ministry this time, we have a model SWC. We have 565 model SWCs that have been planned this year for 2021 that are coming up with two educational institutions in their PSC coverage, which should be declared them as tobacco-free institutions. And for these actually we have a very fixed set of plan of action, and these schools have already been identified all across the state, but we will not be stopping here. We should not be stopping here, and we should move forward to encompass all the educational institutions that are coming under our purview to make this to declare those as tobacco-free educational institutions. Next, please. Next, please. Yeah. So the process of implementation is we have to have some IC display and materials in the strategical location. There's already been designed and have been communicated to the district. Then there is implementation of this no tobacco product, that no tobacco products are sold inside the premises and all, as it was being told discussed by our Director Public Health sir regarding the various rules and regulations. But these need to be, there need to be some signages, some visibility to have around the display of this, so that students should be will have to have can put those in their mind for a longer period of time. Then there has to be some certification, and this is as per the NHM guideline that awarding a certificate to those who score more than 90%. Of course, there have been some classification of this percentage of marks for evaluation, and based on that it will be classified, which should bring out a natural competitiveness among these schools. And I'm sure this is going to be a very good initiative. Next, please. So the mandate from the state perspective, it was already it has been said that the schools will have some signage and all that, but alongside, as they mentioned in the last column, there has to have some tobacco monitors. They must be vigilant to note that tobacco substitute as e-cigarettes and like devices that and vape, and they should not use. But these tobacco monitors can be from anyone who would play very responsible this thing, be it the NSS personnel. I recently, a few months back, I visited and I met personally. I met our honorable Minister of Education, Higher Education of the state, and I also through him I also met our Commissioner of Secretary Higher Education, sir, and both of them have assured us that they would be taking this through their NSS wing for making these educational institutions tobacco free. And of late, they also hold meeting for this to chalk out the plan of action, and they are definitely in a very proper way and very proper direction. Next, please. So these are the displays that one educational institutions need to be. This is an Odia like Tobacco Mukta Sikkha Anushthan. So this has to be, and these are all have been communicated to all the districts from our side. It is a matter of time now to be implemented, and it is the onus is on us to see that these get implemented at the ground level. So we have to really, we really have to work very hard to go for this. Next, please. So the educational institutions, as mandated, they should see that there should not be any tobacco sales within the 100 yards from their premises, and any violation should be reported to the national quit line that has been mentioned here. And the management should also, if possible, with the help of local law enforcement. As I said, this is not a unidepartmental job or business. This has to be through multi-sectoral. There has to be some multiple stakeholders that should come into play. The law enforcers definitely play a role alongside the educational institutions, the educational department, and also the health department to go for it. Next, please. So we have in the state of Odisha as of now have made 1185 school awareness program on tobacco control, and it was in the phased manner since 2014, and 225 college awareness program have been done. And in the current year, actually, we also have 139 school program conducted, and 57 colleges have been in the 57 colleges awareness program was conducted. So the looking at the current PIP proposal, we are confident of making these two institutions for SWC, and basically, as we know, the SWC health and wellness are selected based on the individual block level. So we can say that two educational institutions are being made tobacco free in the state of Odisha in each of the 565 blocks that have been identified, and the educational institutions are all have also been identified already. Next, please. These are few. This is in the Puri Jilla school. This is the signage that was put, and we should not limit ourselves by for putting these signages only. We should bring it to the reality, and all the department. I would appeal to the education department to see that all the educational institutions should come up like this, and all the educational institutions should adhere to the rules and regulations that are abiding for this COTPA and all that. Next, please. This is the tobacco ambassador. We also choose here the tobacco ambassador, and we also felicitate the tobacco ambassadors in the educational institutions, which is a good initiative, because these are the people who will build the nation in the future, and if they would be aware of, then the situation can easily be tackled. This is in the Sambalpur, the district of Sambalpur. Next, please. So the youth power, as we know, because if at one end we can, if at one end we say that there is a shifting of tobacco use, downwards, taking this tobacco. At the same time, we can also say that the youth power, if they can come up, they are the real challenge to tackle it in the society, and they will have a very great impact for this. So this is a great platform to start it with the youth and all. And they should be all the educational institutions, the higher education and the colleges, they should come up with this. And in the state of Odisha, the higher education department has already chalked the plan, and they are coming up through the NSS wing to have an ambassador in their institution to look at the tobacco control measures there and implementation of this national tobacco control program in their jurisdiction college, which is a really great initiative. So the next page. This was also the next one. This was also shown by our DPS, our director sir. Let us not our child. Let us think of our child who would otherwise request us to save him from the ill health of tobacco, because it also has an ill effect for the passive smokers. So let us stop all this. And the next one, please. So on behalf of the state and city cell, I thank you all for giving an opportunity to speak something on this webinar, and also to be connected with the higher education department. And I appeal, if any of the NSS, well, I strongly believe that many of the NSS volunteers should be alive on this YouTube platform, and they are the real force to reckon. They must recognize, they must be recognized, and they must act towards a tobacco-free state of Odisha. which would be a great initiative. Thank you all. Thank you.
Thank you, sir. Thank you for highlighting the effort by state team, and we expect more for increasing our tobacco-free institution in state of Odisha. Now I invite our next speaker, Dr. Sonam Goyal, Professor, Department of Community Medicine, School of Public Health, Chandigarh, who will be sharing his insight on guidelines for tobacco-free educational institution, a way forward. Over to you, sir.
Thank you, Rajiv. First of all, I'd like to thank Dr. Satpathy for highlighting the issue of this tobacco-free educational institution and liaising with the educational department and NSS for getting those guidelines of tobacco-free educational institution implemented in their institution. So I hope that in coming weeks and months, so we'll be having some sort of framework in which health department and education department works in tandem, and we have many tobacco-free educational institutions in the state. So in the next 10 to 15 minutes, I will be briefly telling about what tobacco-free education institution is. So I will not be elaborating upon why it is necessary, although few initial slides talked about why tobacco-free education institution is necessary, but much has been said about the necessity of involving youth. So you can see in this title slide that these are some of the boards of tobacco-free educational institution. We can have tobacco-free educational institution written prominently on our schools, in our colleges, and if anybody is found violating some of the other things which I will mention in next 10 minutes, so then they can be violated. This violation can be reported on the guideline number, which has already been shared by our DPH and Dr. Satpathy. So next slide. I think this is statistics. Now, just one line about it, if I want to tell in layman terms for our students and teachers, every fourth individual adult is a tobacco user in India. Every fourth adult is a tobacco user. And if we take the global youth tobacco survey, which has been done among the schools, which I have not highlighted here, every sixth student age 13 to 15 years is a tobacco user. So every fourth adult and every sixth youth is 13 to 15 years is a tobacco user. Next. So why tobacco-free educational institution? We want to provide a safe and healthy environment, like your parents used to send to the school so that you study, but you don't carry back the disease with you. You don't carry back the smoking, even if you don't smoke, you don't carry the smoke in form of second-hand smoke with you. So that is why your parents send you to the schools. So that's why we want that nobody in your educational institution should smoke or should use tobacco in any other form. Next. Why it has been necessary now? Because as globalization is occurring, as newer techniques, newer smoking aids are happening, hookah bars are opening. So there has been rising trends of tobacco use among students. You have seen, I must be corrected in the fact that there has been rising trend of tobacco use among students, not only in one state, but everywhere. We are all aware about harmful effects of tobacco, but we don't speak because we don't know what tobacco-free educational institution is. Next. So our youth need to be safeguarded, and tobacco litter like all BD butts, smoking butts, if they are just littered here and there in the campus, it gives it doesn't give a very good feeling about the school. And now that there have been aggressive marketing of tobacco companies, especially in the youth. So they are focusing youth in this thing. Next, I've already told about second-hand smoke. So what are those guidelines? So just remember 6 things. 1, there should be no sale of tobacco product within your education institution. No sale. I think you will not find much. In your educational institution, I'm sure that you will not find sale inside the premises of education institutions. Second, no smoking and chewing of tobacco products inside the premises. This is section 4 of our law, COTPA, which says that there should be no smoking and chewing of tobacco product in any public place. So this school, educational institution are public places. If you find smoking and chewing in tobacco product in public place, that student should be reported. Next. Now, just clearly see these signboards. This is one signboard many of you might have seen. This is 2 feet, this 60 centimeter by 30 centimeter, and it is clearly written, no smoking area. And you all are watching YouTube, so you can just type on that whether you find such smoking board in your jurisdictions. No smoking area, smoking here is an offense. This can be written in English, or this can be written in Odia language, in the language which we all can understand. So this board should be there. Next. This is the third thing. Fourth, no sale of tobacco product within radius of 100 yards of educational institution. I have told first point as no sale of tobacco product within institution, but there should be no sale of tobacco product within 100 yards of educational institution. So 100 yards is almost 100 meters, 90 meters odd. So this you need to see that nobody should be selling. In case there is a violation, this is a national number. You can just dial this number 1800112356. It's also a quit line number, but also a violation reporting number. Next. Now, this is fifth. Like, this is very important for you, that you should display educational material in your education institution. Like, these are the diseases caused by smoking. So because if you carry this type of message and information in your boards or in your classes, so I think people, the students will carry home the message that smoking is bad, tobacco is bad. And the school principal should carry a copy of COTPA, our law here, 2003 law. So they should keep a copy. Simple thing. They should keep a copy of the law. This is easily available in the internet. And seventh is sale of tobacco product around educational institution within radius of 100 yards is banned, should be placed. This board should also be placed. You can see the board on the right hand side that there should be no sale of tobacco product within 100 yards of education. It is strictly prohibited. So that should also be displayed on the outermost wall of your education institution. Next. Now, the management of your school should not permit use of tobacco products, and head of educational institution is authorized to collect fine. You can consult the state health department that they can issue the challan book to you, and you can collect the challan in your or fines in your school. And if somebody is smoking, somebody is using tobacco, simple fine of 200 rupees per person. Next. Now, again, very important thing, you all have assemblies in the morning. In assembly, there can be pledge against tobacco, that I will not use tobacco and I will advise my family, friends not to use tobacco. Simple 2 minutes of pledge. You can have poster, slogan, essay, competition, quiz, debates related to tobacco. And if you have someone like this, so you can also have some certificates of appreciation or awards, so that people are motivated, students are motivated. And you can also invite health authorities or local enforcement authorities in the school assembly to deliver a lecture on tobacco control. And I request our education department to use EduSet, and we will be happy to deliver. Our team from Odisha, AIIMS Bhubaneswar, our health department will be happy to deliver the lecture on EduSet, and so that that lecture can reach to many people, many students, many teachers. Next. So I think that is the way forward. As I always I requested that first that you should do all those things to make your educational institution as a smoke-free or tobacco-free educational institution. You can place a board outside your education institution that my education institution is tobacco-free. You should keep on monitoring the progress through regular inspections, and you should create a core of committed students. There are few committed students in your school. You can create a core who can guide, who can teach, who can conduct such sort of plays. So this is how we can create our peers for messengers, peer messengers, or our ambassadors in tobacco control. So I think I end my presentation here. So with the learning that you should all strive towards a tobacco-free educational institution. This is very easy, not very difficult. If you all work hard with our health department, our school will be tobacco-free and our youth will be free from, like, youth can live longer. Thank you.
Thank you, sir, for highlighting the tobacco-free educational institution guidelines. This is very important to know these guidelines with all the students and teachers attending this webinar. So till the time we have, I think almost 400 people seen our webinar live, and it's an honor to have among us Dr. Rana Jaisingh, Deputy Regional Director, Tobacco and NCT Control, the Union New Delhi. I request sir to share his experience in tobacco control and providing concluding remarks with the participants of the webinar. I request Dr. Rana Jaisingh. Welcome you, sir.
Thank you, Rajiv. Can you hear me? Am I audible, first of all?
Yes, sir. Yes, sir.
Yes, thank you. But still, apologies if I am disconnected due to poor network here. But thanks. So, first of all, I would like to thank and congratulate all of you. Respected Dr. Mishra, Director Health Services, Government of Odisha, Ms. Swan, Deputy Secretary, Higher Education. We have our very loving State Nodal Officer, Dr. Satpathy, Dr. Swan from NCD Department, Dr. Goel, Dr. Patro, Dr. Mohanty, and staff of Education Department of Government of Odisha. All the health staff members from Department of Health, State Tobacco Control Cell, District Tobacco Control Cells, staff of PGI and from AIIMS Bhubaneswar. So really, I think it's a great opportunity, and that is why I am feeling it very happy and want to congratulate on organizing this webinar amid this very challenging environment of COVID-19. So why I am saying so? You see, we are all very busy. Through the country and globally also, almost every activity was affected, whether it is trade, whether it is retail business, whether it is hotel, restaurant, travel, everything was affected. But if one industry or one area was not affected, and that was tobacco industry. So what we have seen, हमने क्या देखा last in last 8-9 months, हमने देखा that tobacco industry continued to promote their name, to promote their products, and especially they had advertised many such things which were directly focused to children and youth to attract them to their products. In addition to that, they also tried their best to get access to highest level of political and administrative leadership in the country. So they try to organize various webinars and giving their good image of corporate social responsibility. And then if they did not stop, you really see, really in this situation, they were continuing to promote their products. Despite the fact that all of you are aware that tobacco is a risk factor for even COVID infection. We are aware that tobacco smoking is a risk factor for tuberculosis and other lung diseases. Similarly, now it is a risk factor for getting corona infection, as well as if we are affected by tobacco, if we are affected by corona, we are likely to have more severe disease. So even during these times, they were using this challenging environment to promote their product. So this is something which I would first of all call upon all my young and youth colleagues, our people, our youth ambassadors, that this is something which they need to be aware of. What are the tobacco products, what are their harms, and how tobacco industry is trying to see that they are attracted to their products. So this is one aspect. If they have not stopped, then why? Then how we can stop? So that is why I am really feeling and want to congratulate that all those activities are continuing, and we are seeing that currently it is rather an opportunity. So if we look at COVID infection, this COVID-19 situation, we are using it as an opportunity, and many states across the country has banned, many states across the country has banned smokeless tobacco, smoking forms, even point of sale of tobacco. So we can use this as an opportunity for eliminating tobacco use. You see now regarding what are the responsibilities of education department. First of all, I would humbly request, especially education department, which has a major say in tobacco control. I don't think that health department alone can do that. And if you ask me, after health, who else? Which is the most important other department? It is education department, because this is a department which engages with children as soon as one is 3 years old, joins a crutch or a pre-primary school, and then up to college level. So this is, and then higher education, and then technical education, maybe any field, medical or engineering, so any field. So education department at all levels, pre-primary, primary, secondary, higher education, technical education. So this is one department which engages with the youth at every level. And just to share with you that it is that most of tobacco use in our country happens before one is really before gets or age of 21. So that is an age where a child or a student is in a school or in a college. So I think that is I think very important role they can play. And already the previous speakers has shared what are the responsibilities. We have a law, COTPA, section 6A and B, which is primarily to be needs to be implemented with help of education department. Section 6B, no sale around education department under 100 yard. It is primarily responsible of a principal or a headmaster or in charge of affairs of a education institution. So as far as legislation is concerned, second, no government has given us toughy guidelines that how we can make our education institution as tobacco free. I think all the criteria, all the points which need to be done at each education institution level has already been shared. I won't go into detail, but only one or two things I would like to say in addition to TOEFL implementation in your institution. I would suggest that each school in rural areas especially, you can adopt your village to make it smoke free or tobacco free. Sorry. So you can make it, I think, beyond your education institution. You should see that how you can help to make your village and around areas as a smoke free or tobacco free. Other thing I would suggest that once a quarter, parent teacher association meeting should assess the status of TOEFL guidelines in that particular institution. So once a quarter, I think whenever there is some meeting between parents and teachers, or maybe if independently within an institution, I think they should assess what is the status of TOEFL guidelines, and they need to be implemented, and wherever there are gaps, they should be addressed in that way. So with this, I think I would like to conclude and again congratulate all of you with the full commitment from the union as well as from our colleagues, our partners, that we will continue to work with the state government education department. And I would also request that if it is possible to have a compliance assessment. So we need to see that we can conduct a compliance assessment study. What is the compliance assessment in all these education institutions related to TOEFL guidelines? And very quick survey can be done to assess that compliance. So these are a few things which I would like to share with you. Once again, thanks to Department of Health, Department of Education, AIIMS, Dr. Binod Patro, Dr. Goel, State Tobacco Control Cell, for inviting me and having this webinar, which is very, very timely. Thank you very much. Over to you, Rajiv. Thank you very much.
Thank you, sir, for guiding us all the time. Now I move to our next part of the webinar is question answer session. So we have received many questions, but we will take few questions out of that. So I'm going to take one question by Dr. Nancy Satpathy. How to tackle this problem in Odisha, where minor is allowed to get tobacco product from shop despite of their ages? So I think these questions to Dr. Satpathy.
Rajiv, can you please repeat it?
Yes, sir. So how to tackle this problem? I think the tobacco control in Odisha, where minor is allowed to get tobacco product from the shop despite of their age.
Yeah, I said during my presentations also, I'm not aware if it is very clearly audible also. I mean, I'm very clearly audible also. But then it need to be brought to be implemented in a very realistic way, and there are multiple stakeholders here that need to act upon, like education, Department of Education, Department of Labor, Department of Urban, and those who provide the license to the vending license to the sellers, and also the law implementers like the police and all that. They all need to act coordinated in a coordinated way so that it can be challenged. Unless we do that, it is very difficult to have it, because only sending an order or only having something as a law is not going to help it out. That's what we have seen. It's not only the problem is not only in the state of Odisha, but all throughout in the India itself, the country. So I would rather say that we also had a meeting with the urban local bodies, those who grant the license to the vending zones. But I am not very sure how far they've made it practically applicable, so that the licensing of these sailors would be completed very fast. That is one thing that we must look at.
Rajiv.
Yes, sir. Thank you, sir. Yeah.
Yes.
Yeah. So our next question is by Pranav Swain. How to control the use of tobacco in college premises is more important. Like how we control in college premises. So I think this is a common question. Maybe any of the speaker can take. Yeah.
Yes, sir, Rajiv. Dr. Rana here.
Yes, sir. Please.
Can you hear me, Rajiv?
Yes, sir. Yes. Yes.
So thank you very much. So, yes. So as far as so both questions. So both questions are simply these are enforcement issues. Not to so that they cannot assess and they cannot get tobacco. It's purely an enforcement issue. All the procedures has been explained in section 6A and B. It is first of all tobacco vendor. Tobacco vendor who is selling a tobacco product, he needs to ensure that whosoever any child or a person who has come to purchase tobacco product, he or she is not under 18 years of age as per the current law. If he or she has any kind of doubt that the person is below 18 years, that can ask the proof of age. So responsibility, please see, responsibility lies with the vendor. Confirming the age of the purchaser is a responsibility of the vendor. At the same time, enforcement official also need to ensure. And second part again, it's an enforcement issue. Whosoever purchases tobacco, whether any youth is. So both questions are related to effective enforcement, and concerned enforcement officials must be aware of all these issues. Thank you, Rajiv.
Thank you, sir, for responding both the questions.
Rajiv.
Yes,
Rajiv,
sir.
Dr. Patro this side. Dr. Sushant
Yes, sir.
joined. Can we ask him to make his remarks on this program? He had a presentation. Who is the state nodal for cancer additional director, and Dr. Sushant Swami, and I think you would announce Dr. Sushant to join. After that, we'll take few questions. And
yes, sir. Thank you, sir. Welcome, Dr. Sushant, sir. So can I move with the question session? Yeah. Now I request Dr. Sanshu.
तो पहले बोलने के लिए देंगे, उसके बाद क्वेश्चंस ले लेंगे.
Yeah, sure. Yeah. So I request Dr. Sushanta for taking the session on. Just a minute. I will share the presentations.
Yeah.
So do I share? Yeah. Do I share the presentation, Dr. Suzan Sakma?
Yes, it will be good if you can share the presentation.
Yeah.
Sir, namaskar. Sir.
Namaskar, Vinod. So good afternoon, everybody. So I'll be talking about roles and responsibility of education department in tobacco-free educational institutions. This is the ideal way to enforce tobacco use, because the primary users of tobacco and are the adolescent boys and girls in their teenhood. They learn how to they experience they venture out to take tobacco for the first time, either in chewing or smoking form. This is the age when they get affected. They don't have enough capacity to take care of their decision, so they sweat out that, and there is enough peer pressure also when they're at school. They feel very independent and free to use that, and peer pressure has a greater role to get involved. So it is our responsibility for those who are in education department, institution, principals, deans and teachers, and even the classmates. They have got a greater role to play. So we have to make all the institutions tobacco free, which is the mandate of the tobacco control program across the country. Can I move to the second slide, please? And intersectoral coordination is the key for implementing the tobacco control program at whichever level you think. So if it is a block level or if it is a taluka level, the teacher, the primary health teachers, the block development officer, and the PRIs who are present over there, and the environment, the family members, the parents, they're also responsible. So what the key department, there is key departments, so civil society department, academia, doctors, and victims in the users, and the media, they play a greater role. Can I move to second one? Next slide, please. Okay, and key departments engaged in tobacco control program are, they start from Labor Employment Department, Home Affairs, Finance, Social Justice and Environment, Commerce Industry, Agriculture, Science and Technology, Panchayati Raj, Education over and above, Rural Development, Railways, Transport and Commerce, Information and Broadcasting. All of them are interlinked and they have to play a greater role. And we will highlight the roles of Education Department now today. Next slide, please. Okay, so what we have to do at school, at colleges, and for NTCP, making schools and colleges tobacco free. We can put a signage over there and make everybody aware in the local language and what the signage means and what the signage means, and we can have group discussions, interact, and the school authorities, suppose the district education officer and the team who are monitoring the educational institutions, they have to see whether the institutions are following it or not. Education department and school principals should issue directions to the authorities who have to handle this. School and college tobacco focal point and teachers should be identified, a nodal person to be. In Odisha, we have identified NSS program officers of the institution, because we are discussing with the higher education department today. So some NSS DP program officers are also here in the group. It is the enormous load, the role they have to play. And the peer leaders, NSS members, NCC members, and the youth also. And I want to highlight one more thing: those people who are the dropouts of the school are also primary or secondary influencer of the children who are in the school, or the boys who are in the boys and girls in the school. They influence much. So school dropouts entry to the institution also plays another important role. And if the enforcement is there and the tobacco institution is made tobacco free, that 100 meters, that 100-yard notification yellow line has to be identified. No seller should be available, and the sellers should be notified beyond 100 meters also, not to sell tobacco to the minors below 18 years. They should not sell tobacco. The parents and community also play a greater role. And home department designation of law enforcers has to be there, because I today only attended a meeting on home department staff orientation at Puri. Today they are conducting a meeting sensitization on the CMOH and the tobacco consultant of the district, and superintendent police was represented by a DCP and over there, and excise department is also called, because Puri is under NDPS activities there. They had very active discussion and they defined, and the Puri Jagannath temple is also declared tobacco free, and chewing tobacco this is prevented and notified. So similarly, the society also has got to play, because the schools and the environment of the schools should be like that. Nobody should allow tobacco in the notified area. Next slide, please. Okay, roles of education department, that is issuing advisories, as I told, to educational institutions to conduct awareness programs for the students on harmful effects of tobacco usage, imparting education of ill effects of tobacco consumption and disallowing consumption with the campus. If you remember one ad for tobacco use, somebody chewing the piece of a chunk, somebody squeezing the piece of a sponge, and the coal tar is coming out of it. That fear complex should be created among the people, among the target population, so that they will never be encouraged to use tobacco further. That is another way of motivating people and educating people. That is a good idea I have seen in the televisions. The enforcing the ban on tobacco products within 100 yards, that I have told. Then enforcement of section 6A and B in the educational institutions, monitoring its compliance, monthly review meetings conducted by the chief education officer of the district, mandating COTPA compliance, any school adult audits conducted, whether the COTPA compliance is being followed or not, that should be audited, and not participating in any event like those are promoted by tobacco sellers or companies. Next slide. The state education department to insinuate the tobacco control in incorporating tobacco control activities in the academic calendar also. They should have a calendar of activities. And we can also say, suppose we have a debate competition, essay competition, and drawing or painting competition in the institutions, we should also encourage students to take part in tobacco control program activities for those competitions also. And we can have volunteers, at least 1 or 2 volunteers in a class of 40 or 50 students, so who can monitor, use, and report. And those informer rights should be protected also, because those should not be disclosed. Who is informing? Those informer victimization should be prevented also. So to make efforts to get questions related to tobacco-free education is included in the existing monitoring and inspection mechanism. So the checklist should be there when the monitoring is happening. Representative of state education department should be in the cooperated in the state and district, because Odisha, we have a district level coordination committee for tobacco control under the chairmanship of the district magistrate and collector, and CDMO is the co-chair there. So in that meeting, we can also have representative from education department to represent education department and this prevention of tobacco activities also. Next. Guidelines are to display tobacco-free school, tobacco-free institution board signages at prominent places of the boundary wall outside the main entrance, or near the toilet or a common prayer room that can be. And the specifications are given by Government of India. It should be 60 and 45, and no sale of tobacco product inside the premises within the radius of 100 yards. The no smoking of chewing tobacco inside the premises of institutions and students and teachers and other members of visitors. And no teacher should send somebody to buy tobacco products for him. It may be practiced in some areas which have come across during our earlier days, and we should also get 30 and 60 and 30 centimeter size inside. No smoking area. Smoking here is an offense should be highlighted. The next slide. Posters with information about harm effects should be displayed. Students shall be encouraged to make their own posters. Those should be displayed. Suppose a wall magazine or wall painting exhibition can be conducted. People will encourage for the more creative activity. A copy of cigarette and other tobacco COTPA Act shall be available. The principal and head of the institution and the nodal officer identified that means the NSSPO should have that. The tobacco control committee should be in place in the school, so that because one person cannot monitor or implement it in single-handedly. So representatives of the teaching staff, the non-teaching staff, the parents, and the PRA members, and school secretaries, school managing committee members can be a part of it. Next. Integrate tobacco control activities with ongoing school health program also, because under RBSK, Rashtriya Bal Swasthya Karyakram, Kishor Swasthya Karyakram, the teams are visiting for screening different diseases, including their deformities and the blindness. Those programs, they can also be encouraged. There is a counselor, RBSK counselor is also there, and health worker is there. They should be oriented at district level, so that they can have some skills to counsel the people, the children who are on tobacco, are used to tobacco. Then promote writing anti-tobacco slogans in schools and institutions, institute stationaries. Then principal and head of the office shall recognize tobacco control initiative by students, teachers, and other staffs, and certificates. Appreciation of awards may be given. Suppose 2 mentors in the class who have played their role very well and they have made their class tobacco free, they can be awarded in annual day or something like that. Next slide, please. No. These are some examples of signages, and it should be bright, highlighted, yellow colored. That should not be dull like black and white, which may not attract. And the signages should be very loud and clear. And the call center, in addition to your caution, you should also display helpline numbers like this. So in the prayer classes, early morning assemblies should be used for sensitizing the students, and slogans, those who are selected, this can be highlighted. So in the school, what we have to do at first, we have to educate them, educate the children, and the teachers and the non-teaching staffs, and set examples. Teachers themselves and non-teaching staffs and parents should also set examples by themselves, that they will be influenced by that, and monitor the activities, whether the tobacco control activities are which have been notified are being happening regularly or not. And if you in the morning, every morning when the sweeper cleans the school veranda, you can see watch for whether it is really happening or not. That means tobacco covers, that's the disposable covers are being gathered at the end of the school dustbin or not. You have to check that whether that is in there. Or somebody using and spitting around with some tobacco chewing, and those are the habits, those should be prevented. And through COVID, we have also notified, governments have also notified there is there is 500 rupees fine for anybody spitting in the public group. That should be there. And the penalty should also be there. In addition to everything that is monitoring, then enforcement, vigilance. Vigilance means randomly, not only the person who is a nodal person for tobacco control, the other persons also can also take part in having vigilance in classes during recess hours or during the class is not there, teacher is not there, then that can be that this should be on vigilance. Then and the toilets should be checked for any tobacco chewing wrappers or something like smoking butts, cigarette butts, so we should check that. Then counseling should be there. In addition to only enforcement cannot do. Suppose somebody is using tobacco and used to it, maybe chewing from or gutta or something like that, then that person should be counseled. And the privacy of he or she should not be feeling offended because he or she is using tobacco. Then penalty is the last resort. We can go for that penalty if instead of repeated counseling and repeated initiatives taken by the school authority, we can send notices to the parents for sending them through school living certificates. Okay. Next slide. So this can be ideal, but this shouldn't be so busy. Those the posters or signages should not be so busy so that somebody cannot make it out. It should be very clear, loud, and one message should be there. And the toll-free number should be very well visualized in the signages. Next. So thank you. This is all what I thought to be important for this meeting, to talk to the education department people and NSS POs present over there. Thank you for giving me a chance.
Thank you, Dr. Shrutansa Kumar, for providing a brief description.
It is very clear, Sushanta, I am not Sushanta Rajput, Sushanta Swain.
Yes, sir, Sushanta Kumar Swain, yeah. Now, can we take one or two questions, sir? Dr. Patru, sir? Yeah, should I move to?
We'll take two questions, then we'll close.
Okay, thank you. Yeah, so question by Dr. Lilian, what are the various ways of restricting an already tobacco addicted person from consuming it? I think it's a big challenge. So how we tackle this situation? So those are who are already addicted. So I think
सर बोल सकते हैं
Suggestion kata कहउछन
sir.
Telling about
Yes.
suggestion.
Yes, sir. Yes.
We have established tobacco suggestion centers in some districts, but it is not that vibrant as we expect to be. Okay, we have tobacco counselors, even those district street counselors also, it is not that much visible. Visibility is not there. We should come out in a way which should be visible, and people should, when they're passing by, they should know this is the tobacco person. He will catch hold of us. नहीं तो कुछ भी बोलेगी, एक दो शब्द बोल जाएगी जो हमको हमें अच्छा नहीं लगे, ठीक है? So that should be that. So suggestion centers definitely should be there. And do you think to have in institutional suggestional centers in educational institutions, and referral to suggestion centers should be there, very much there. Apart from toll-free numbers, if the teacher say that the person is very much habituated to that is not able to be after counseling to the parents also, so we can refer them to the suggestion center, and follow-up activities should be there. And one thing it was being discussed when Chitrangam Madam was the Secretary Education and Pramod Merda was there, we are discussing that taking place only by the NSS volunteers or the students once for quitting tobacco will not be sufficient enough unless we adopt one school or institution. If you find 10 to 15 tobacco users and make them revive from it and start, they should quit tobacco, that will be the only successful venture what we see as a dream. If we can do that, that will be the only goal. This person should be free from tobacco, and nobody in the school is using tobacco, because that requires continuous follow-up, reiteration, and we have to counsel. That is the only thing what we can do in addition to enforcement. Anything Vinod can add?
Thank you. As you have told, is tobacco cessation is a very complex process, and the outcomes are not very promising. So, as you say, they are not attractive because the outcomes are not very promising. Okay, so the provider satisfaction is very low. Those who are providing cessation services, they are also not very happy, because if you do practice those, they practice in other things, tobacco cessation counselors and other things. If they practice rehabilitation, if they practice counseling in other areas, so that's the fag end of the story. That is why the focus has to be shifted to prevention rather than cessation. Cessation has to be there. It has to be the end of the story. And as you say, sir, it has to be in every district at least. Cessation services has to be in more industrial settings. We haven't seen educational institutions to start with, but at least health setting and industrial settings, cessation centers have worked. Have worked and be promising.
So just want to add, Rajiv, to Dr. Patros and Dr. Swain, because we have been working in PGI with a few of our colleagues, and we are also facing this problem of what Dr. Patro is talking about. It's very difficult. But now what we have done is we have done three things. Although I am not saying that these things are also very promising, but we could find good success rate as compared to the previous strategies. Like what we have done is we have chosen the NCD clinics where the people are already coming with their problems. So those opportune things actually provide a window where we can counsel, and they are able to accept that. This is one. Second thing is, when we are designing the messages, we are designing the messages based on their own NCDs. Like if somebody is suffering from hypertension, we'll talk just about hypertension. And we have tailored pamphlets and everything on hypertension. And we have a local case story into it, in that pamphlet. A local person going to somebody, so suffering from hypertension, and so that they can connect themselves. So this is the another thing which we have tried to do. And third thing which we have tried to do is like some sort of religious context. So in Punjab, the thing is that the smoking and this thing is a taboo. But people are coming over, and then they are smoking from other places. They are coming over. So we have tried to put some of the religious context of their gurus and in that pamphlet, so that people can accept, because many people don't want to abide. Everybody wants to abide by the religious things. So we have put some religious text into it. We have done local things. So I think we need to make a tailor-made interventions rather than a generic interventions to make it a success. So this is my just a small comment on it.
Thank you, sir. So I have one last question by Maitri Mamta Panda. So why government not making a direct law over the advertisement of tobacco product? So I think Dr. Satpathy.
Dr. Rana is the best person.
Yeah,
Dr.
Rana, sir.
Hello, Rajiv ji, thank you very much. In fact, first of I would like to inform that we already have a very robust law. India's section, our COTPA section 5, that prohibits every kind of advertisement, and perhaps it is the most robust the section which prohibits advertisement, direct advertisement, indirect advertisement, promotions and sponsorships. And there is overall good compliance is happening except point of sale. The violation which you often see about surrogate advertisement, about pan masala advertisements which you see, whether it is Shikhar pan masala or it is Baba or Il Baba Laichi or all those things, they are surrogate advertisement, and government has not been able to do much on that because our two laws are on conflict with each other. One act under Information and Broadcasting Ministry that permits any advertisement of a product. So that permits advertisement of pan masala, which is why it is permitted, because it is still not considered as a sin product. Still, pan masala has not come in the category of a harmful product. If we cannot advertise those products, so our that law permits advertisement, but COTPA, which came later on, which came in 2003, that prohibits advertisement. So policymakers and our tobacco control advocates, they are already working with the governments to ensure that the previous exemption which has been given for surrogate advertisement, that can be removed. So already COTPA is under amendment. Already bill which was put in 2014-15, that was later on withdrawn, but again government is thinking of putting it maybe in this session. It was supposed to be in the previous session, but because of corona it has again stopped. I think things are not happening the way it was planned. So COTPA amendment to prevent surrogate advertisement, that is already underway. And
Rajiv,
also
any
the
further
other
questions?
law, yes, other law is also being
Yes, sir.
complemented. Thank you.
Thank you, sir. Thank you for highlighting this query. So we have many questions, but constraints of time, so we will going to close the question answer. We have very common questions from many people. Dipali Sahu, Mona Swami Sahu. If tobacco is bad, so why don't we stop the making tobacco? It's a very common question. We will see all the time these questions. So I thanks all the participants who joined through YouTube channel. So I, before going to vote of thanks, I request our speakers to make last comment if they have. Dr.
Yes,
Sushant.
Rajiv.
Yeah. Yes, sir.
Just because now if this question is there, which you mentioned, yes. So first
Yes,
of all, I think our workshop is not successful until unless this question comes. So this is a question which always comes, and when this question comes, we really feel happy that yes, our participants are thinking in that way, that why we are talking about tobacco control, why so many people, you see Dr. Susanta and all my colleagues, Dr. Patro, everyone is sitting here. So just to update that you see tobacco is not a public health issue alone. Almost 10 ministries are involved in tobacco growing or tobacco business or tobacco industry. Tobacco is a crop, agriculture ministry, commerce ministry, revenue, finance ministry, forest and environment ministry. Tendu Patta comes from the forest, so that ministry is involved. Millions, and it is a trade. So millions of traders are involved in this product involvement, and then ultimately responsibility has been given to health department. So health department cannot alone control tobacco. So it is a multi-ministerial issue. And I would like to also say that no country in the world has been able to do that, because currently governments are grappling with the socio-economic or economic issues related to tobacco. For example, if we say 5 million BD workers are involved, I am not saying that they should continue, but at the same time, governments take decision in a different way. That is why we always say tobacco is not a public health issue, it is a political issue. So until unless Prime Minister himself sitting with all their ministers take that decision, it is not possible. And still that commitment has not come in any country in the world. some steps have been taken in Bhutan, which say that, but again, there are so many exemptions. Bhutan is the only country which has banned tobacco, but so many exemptions have been given there that still tobacco is available there. So tobacco is a political issue. Tobacco control is a political issue. It is not a public health issue. So we need that kind of commitment at highest level, and we are very concerned about this. Personally, I also feel that why I should continue, for how long I will be continuing to talk tobacco control. Already maybe it will be take me 50 years. I won't be able to see tobacco control happening in our country. So we are not sure what will be the end. Definitely we all who are here, we wish end game for tobacco. We wish end game for tobacco. But it's a big issue, and definitely we are going to achieve that also. First of all, we need to reduce, for example, Odisha, or everyone who is here from public health side. Currently, Odisha has a tobacco use prevalence of 46%. So first of all, please see how you can reduce tobacco use prevalence by reducing availability and accessibility and bring it to the 5 or 10% and then push tobacco out of your state. So this is the way tobacco control happens. So thank you very much once again, and over to you, Rajiv.
Thank you, sir. We will definitely achieve our goal to make our society a tobacco-free society. Any last comment by
just
Dr.
a liner.
Yes.
Just a liner.
Sorry. Sonal, sir.
Yeah, please go ahead, sir.
Just because a lot of NSS volunteers and students are live on the YouTube, I would like to have a request for them all that it's a fact that government is doing, government at least is trying to do quite a lot, but it will be still better if they would come out as self-volunteered way to combat this. Why can't they push it as a tobacco fighter or a tobacco volunteer of their institution and then push it to their teachers? I'd like to appeal to all the students from all the institutions to go for that. Maybe that will work. Thank you.
Yeah, I will extend Dr. Satpathy in saying that as we do, although government is responsible for our health, but we are more responsible for our health than the government. If we are unhealthy, then we are being taken care of by our family, and we can't take care of our family. So for that reason, I urge all of you not to smoke or not let anybody smoke. So today, just pledge that you will convince, or you will not convince, maybe you will say 5 individual, which is relative to you, that you should not take tobacco in your life, or you should not take tobacco. Just 5%, and say to these 5% that you have to say to next 5 persons that I will not smoke, I will not take tobacco. That's all from my end.
Thank you, sir.
There is a lot to discuss, but the time is short. So we can plan 2 or more such interactive sessions in future. We look forward. And one thing I want to say, alumni celebrities, can they visit the educational institution once to say 2 words to their alumni, students, to quit tobacco? That will be the better one. And that the teachers and those founders can also mobilize that. That is my suggestion.
That's a very good idea. That's a very good idea, Dr. Santa, I think.
Thank you, sir. Any last comment by Dr. Vinod Patro, sir?
No, thank you. I am happy that now we can see convergence between education and health. And Dr. Sushant and Dr. Satpathy, my dear colleagues, both are very active, very passionate about tobacco control. Dr. Sushant works in oral health and cancer, which is closely, and there are multiple programs both of them handle under their leadership. And we look forward for more convergence, more issues, as Dr. Goel was saying, that there is something called reality pyramid. Reality pyramid talks about when there is a brief counseling by a physician at a NCD clinic by 1 minute, the chances of quitting is this. And minimum of 2 minutes is as good as 3 to 4 times of quitting. And 5 minutes counseling is way better. So let's try this. As Dr. Goyal was saying, I am sure Dr. Satpathy and Dr. Swami will agree with us. We can start with the district and city clinics and integration at district and city clinics, and then scale down to lower levels. Thank you very much.
Thank you, sir. Thank you for providing a great communication. Now I move to our last part, vote of thanks. So it has been a great honor and privilege for e-Resource Center and AIIMS Bhubaneswar to thank you, Ms. Dr. Surekha Sundari Swain, Deputy Secretary cum NSS Coordinator, Higher Education Department, Government of Odisha, for accepting our request for joining as a chief guest for live webinar on tobacco-free educational institution hosted by jointly PGI Chandigarh, AIIMS Bhubaneswar, Department of Health and Family Welfare, and Higher Education Department, Government of Odisha, with support of International Union Against Tuberculosis and Lung Health, the Union. I extend my special thanks to our speaker who agreed to be a part of this webinar on very short notice. Your team presence has facilitated the session to achieve its desired goal and objective and outcome. I, on behalf of entire team, partner of the program, extend my heartiest salutations to your good self for sparing your valuable time and sharing your insight and experience with senior official attending the webinar, and looking forward for your support and sustenance in future endeavors. Special thanks to all of you for showing your keen interest in this event, without which none of us would have to come this far. Please feel free to reach our website www.rctcpgi.org for more information regarding the same. All participants, please make sure to fill and submit the feedback form link shared in a chat box. Thank you all. Thank you for joining this important webinar. Thank you.
Thank you, Dr. Thank you, Rajiv and Dr. Purohit. You have been the backbone for this webinar, and you have connected with everyone. Thank you for the support you have provided and follow up in last 3 to 4 days, which you have been doing for last 1 week. So special thanks to Rajiv and Dr. Purohit. So with
Thank you, sir.
Yeah, please.
Thank you for guiding us all the time. Thank you, sir.
So with this, we'll close call it a day. So thank you very much, Rana sir, Dr. Goel, Susan sir. So we close this and we continue our work and move to the field from academics. And we have now more people in the field, 400 to 500 ambassadors are with us. So our work will be a little easier. Thank you very much.
Yes, thank you, sir.
Thank you, Dr. Patro. Thank you, Rajiv. Thank you, everyone. Bye-bye.
Thank you, sir.